Are you tired of spending overnight reading books and having difficulty remembering all those contents just to pass your upcoming examination? Nursing Studio makes it easy for you. We provide detailed explanation on nursing lectures in a more fun and exciting way. Through animated presentations, this will help you save time and easily remember important things, so that you can make sure you will have that name extension after your last name and have that license ID soon to be in your hands. Just get a paper and pencil and watch the video. You will be presented with several sets of questions and write it down if you got it correctly or not. A notification will be indicated if you are already on the last question. Pass rate is 100%. Let's aim for the stars, so that in case we wouldn't make it, we will still land in the moon. So hit that subscribe button and turn on notification bell so that you wouldn't miss any of my video. Let's get started.
Question number 1.
Define Giardiasis. A. Parasitic infection in the intestine. B. Life-threatening condition caused by a rapid loss of blood. C. Late stage of scarring, fibrosis of the liver. D. Clouding of the normally clear lens of your eye. The correct answer is letter A. Parasitic infection in the intestine. Some people generally show up symptoms 1 or 2 weeks after exposure, which includes diarrhea, greasy stools, abdominal pain, vomiting, fatigue, nausea, and abdominal gas. Rationale for incorrect answers. Life-threatening condition caused by a rapid loss of blood due to bleeding that leads to organ failure is known as hypovolemic shock. Late stage of scarring, fibrosis of the liver is known as liver cirrhosis. Clouding of the normally clear lens of your eye is known as cataract.
Question number 2.
What is the causative agent of giardiasis? A. Clostridium botulinum. B. Treponema pallidum. C. G. lamblia. D. Streptococcus and staphylococcus. The correct answer is letter C. G. lamblia. G. lamblia or Giardia lamblia, also known as Giardia duodenalis and Giardia intestinalis, is a flagellated parasitic microorganism that colonizes and reproduces in the small intestine, causing a diarrheal condition known as giardiasis. Its inactive early stage of its life cycle is called cyst. Rationale for incorrect answers. Clostridium botulinum is the causative agent for botulism. Treponema pallidum is the causative agent for syphilis. Streptococcus and staphylococcus are causative agents for cellulitis and skin infections.
Question number 3.
Nurse Mimi is trying to gather patient's history to Aaron, who was diagnosed with giardiasis. What is the expected response of Aaron? A. I was so hungry so I ate an old stocked burger in the fridge. B. We ran out of water supply from the faucet so I drank from the river. C. I starved so much so I ate a canned good even though it's already expired. D. 3 days old dry raw fruits look so delicious, so I ate them without washing. The correct answer is letter B. We ran out of water supply from the faucet so I drank from the river. Commonly infected animals are cats and swines. Once their feces gets in contact with bodies of water such as rivers and lakes, Giardia lamblia passes through and can survive up to 7 weeks. If these bodies of water are consumed by human, the microorganism then multiplies in the small intestine, causing the disease. Ways to kill Giardia lamblia. Number 1. Boiling the water for 1 minute instantly kills the microorganism. Number 2. 1 drop of bleach per 500 milliliters water. Number 3. Using 1 micron filter wouldn't allow the microorganism to pass through the filter. Rationale for incorrect answers. I was so hungry so I ate an old stocked burger in the fridge is incorrect as the food undergoes heating process which instantly kills Giardia lamblia. I starved so much so I ate a canned good even though it's already expired is incorrect because expired canned goods can cause botulism and not giardiasis. Its causative agent is known as Clostridium botulinum. 3 days old dry raw fruits look so delicious, so I ate them without washing.
Do you know that this answer is also correct? Giardia lamblia can also be transmitted through inanimate objects such as clothes, toys, and uncooked foods. Tip: in the actual nursing licensure exam, you will be presented with multiple correct answers. All you need to do is to apply the process of elimination, which is removing the incorrect answers one by one. So what makes this our second correct option? As discussed earlier, Giardia lamblia survives in a wet environment up to 49 days, which is in option B. It can only survive less than 7 days in dry environment, which makes letter D a less priority answer.
Question number 4.
Upon arrival of Aaron to the hospital, Nurse Mimi tried to pinch his skin in the abdomen. In IMCI, pinched skin goes back slowly. Sunken eyes. Restless and irritable is classified as A. No dehydration. B. Possible dehydration. C. Some dehydration. D. Severe dehydration. The correct answer is letter C. Some dehydration. In IMCI, the patient is observed based on her signs, classified to as what type of dehydration, and then treatment is identified based on the classification. The first category we have is color pink. If 2 of the following signs are observed: lethargic, or unconscious, sunken eyes, not able to drink, or drinking poorly, skin pinch goes back very slowly, then we classify this as severe dehydration. Treatment: if child has no other severe classification such as pneumonia, give fluid for severe dehydration, also known as Plan C. So here's what Plan C looks like. Can you give intravenous IV fluid immediately? If yes, then start IV fluid immediately. If the child can drink, give Orsol by mouth while the drip is set up. Give 100 ml per kilogram Ringer's lactate solution or, if not available, normal saline. If no, then, is IV treatment available nearby within 30 minutes? If yes, then refer urgently to hospital for IV treatment. If the child can drink, provide the mother with Orsol solution and show her how to give frequent sips during the trip. If no, then, are you trained to use a nasogastric tube for rehydration? If yes, then, start rehydration by tube or mouth with Orsol, give 20 ml per kilogram per hour for 6 hours. Reassess the child every 1 to 2 hours. If repeated vomiting or increasing abdominal distension, give the fluid more slowly. If hydration status is not improving after 3 hours, send the child for IV therapy. After 6 hours, reassess the child. Classify rehydration. Then choose the appropriate plan A, B or C to continue the treatment. If you are not a nasogastric trained nurse, then, can the child drink? If yes, apply the same treatment. If no, then, refer urgently to hospital for IV or nasogastric treatment. Going back to the table. If child also has another severe classification such as pneumonia, refer urgently to hospital with other giving frequent sips of Orsol on the way. Advise the mother to continue breastfeeding. If child is 2 years or older and there is cholera in your area, give antibiotic for cholera. The next category we have is color yellow. If 2 of the following signs are observed: restless or irritable, sunken eyes, drinks eagerly, or thirsty, skin pinch goes back slowly, then we classify this as some dehydration. Treatment: give fluid and food for some dehydration, also known as Plan B. If child also has a severe classification, refer urgently to hospital with mother giving frequent sips of Orsol on the way. Advise the mother to continue breastfeeding. Advise mother when to return immediately. Follow up in 5 days if not improving. Lastly, we have green category. Not enough signs to classify as some or severe dehydration. Then we classify as no dehydration. Treatment. Give fluid and food to treat diarrhea at home. Also known as Plan A. Advise mother when to return immediately. Follow up in 5 days if not improving.
Question number 5.
Nurse Mimi is about to take the temperature of Aaron, who is experiencing diarrhea and vomiting caused by giardiasis. What is the best way of taking Aaron's temperature? A. Oral. B. Radial. C. Using heat temperature tape. Or D. Axillary. The correct answer is D. Axillary. This is a non-invasive way of taking patient's temperature who is experiencing diarrhea and vomiting. Oral is invasive that might lead to another pathogen in the digestive tract. Radial temperature wouldn't yield as accurate as axillary. Heat temperature tapes cause further restlessness as sticking something to the head gives discomfort to the patient.
Question number 6.
Checking skin turgor and checking temperature is what part of nursing process? A. Assessment. B. Diagnosis. C. Planning. Or D. Implementation. The correct answer is assessment. Anything that involves checking something, such as pulse, vital signs, and others belongs to assessment. Diagnosis involves using clinical skills and judgment to make a diagnosis about current or potential health condition. Example for this is identifying fluid volume deficit and risk for infection. Outcome, also known as planning, is where goals and outcomes are formulated. It is where nursing care plan is essential on this stage. Implementation is the stage when a nurse provides interventions such as medication administration, tepid sponge bath, and monitoring. Evaluation is the identification if the goal is met, partially met, or goal not met. Example: goal met. Patient no longer shows signs of dehydration. Just remember the word ADUPI.
Question number 7.
It is defined as a muscular enlarged pouch or sac that lies slightly to the left, which is used temporary storage of food. Since this question is just very easy, there would be no options provided on this item. The correct answer is stomach.
Question number 8.
Based on the illustration, label the parts of digestive system as sequenced. 1, 2, 3, and 4. This will only be considered as 1 point. Any wrong answer will automatically mark you as incorrect. Number 1. Duodenum is the first part of the small intestine. It is located between the stomach and the middle part of the small intestine and has a length of 7.9 inches. It's largely responsible for the continuous breaking down process. Number 2. Jejunum. The primary function of the jejunum is to absorb sugars, amino acids, and fatty acids. It has a length of 2.5 meters. Number 3. Ileum. The final and has a length of 3 meters. The longest segment of the small intestine. It is specifically responsible for the absorption of vitamin B12 and the reabsorption of bile salts. And number 4. Large intestine, also known as colon. It has a length of 1.5 meters, functions primarily in reabsorbing fluids and process waste products from the body, preparing for its elimination. Meet DJ Ileum. He will help you remember the sequence of the small intestine. D for duodenum, J for jejunum, followed by ileum.
Question number 9.
It is defined as the ability of the body to defend itself against invading agent, such as bacteria, viruses, toxins, and foreign bodies. A. Hormonal balance. B. Secretion. C. Adaptation. D. Immunity. The correct answer is letter D. Immunity. Adaptation is the ability to adjust to environment for survival. Secretion is a generic term for substance production. Hormonal balance is the regulation of hormones in endocrine glands.
Question number 10.
Since Aaron is experiencing tented turgor, dry mucous membranes, and restlessness, which nursing diagnosis should Nurse Mimi focuses to? A. Fluid volume deficit related to gastrointestinal losses. B. Imbalanced nutrition less than body requirements related to nausea and vomiting. C. Disturbed thought process related to central nervous system effect of the diseases. Or D. Risk for injury related to altered mobility and disorientation. The correct answer is letter A. Fluid volume deficit related to gastrointestinal losses. Fluid volume is directly proportional to blood volume, where blood pressure and electrolyte supply relies on for optimal body function. If fluid volume decreases, it also lowers down the blood pressure and supply of electrolytes in the body, causing hypotension and cardiac dysrhythmias. Other nursing diagnoses such as imbalanced nutrition, disturbed thought process, and risk for injury can be addressed if we can maintain fluid volume for a patient experiencing diarrhea.
Question number 11.
The doctor came to check Aaron's condition. To confirm Giardiasis, he issued a laboratory test to be performed. What is the laboratory test to confirm Giardiasis? A. Prothrombin time. B. Stool exam, C. urinalysis. Or D. Complete blood count. The correct answer is B. Stool exam. The procedure will confirm presence of Giardiasis cyst and ova in the stool. Rationale for incorrect answers. Prothrombin time is a blood test that measures how long it takes blood to clot. A prothrombin time test can be used to check for bleeding problems. It is also used to check whether medicine to prevent blood clots is working, such as warfarin. The procedure is done by preparing a vacuum tube buffered with 3.2% sodium citrate. 4.5 milliliters of whole blood is then placed in the vacuum tube. The sodium citrate will prevent the blood from premature clotting in order to yield accurate result. All reagents involved on this procedure are bath in 37 degrees Celsius, as temperature is a great factor for clotting. The whole blood is then centrifuged under 2000 rpm for 15 minutes. Once done, we have now separated the plasma from the red blood cells, which is about 55% of the total component. Leukocytes and platelets less than 1%. And erythrocytes, which is 45%. 0.1 milliliters of plasma is then separated in a tube. The final test is done upon mixing it with 0.1 milliliters tissue thromboplastin plus calcium chloride. A timer is then set and record how many seconds it took to form a gel-like coagulation. Normal value should be between 11 to 13 seconds. Higher than that may indicate effects of warfarin if the patient is taking the medication. Liver problems, as it is the source for clotting factors 5, 7, 9, 10, 11 and 12. Vitamin K deficiency, which plays a big role in coagulation. DIC, or disseminated intravascular coagulation. A serious condition in which blood clots form throughout the body, blocking small blood vessels. This results to increase prothrombin time as clotting factors are being consumed. Urine analysis. It is a test to diagnose and monitor several diseases and conditions such as kidney disorders and urinary tract infections. Colors and indication. Pale straw to deep amber will be considered as normal. Bright red to brown red indicates hematuria or presence of blood in the urine. Brown to strong yellow indicates presence of bilirubin. This happens for patients with liver problems. Dark urine is for dehydration. Green urine is an indicative for presence of Pseudomonas. This is also evident for patients taking chemo drugs such as mitomycin. Clarity should be clear, cloudy, or turbid. Normal urine consists of mucus, sperm, prostatic fluid and skin cells. It needs attention for presence of white and red blood cells, including pus and bacteria. Frothy or foamy indicates presence of protein in the urine. This happens if there is a problem with your kidneys, as protein can leak into your urine. Odor should be not offensive. Fishy smell or ammonia-like is an indicative for urinary tract infection. Pear drop or acetone-like smell is an indication for diabetic ketoacidosis. A serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones. Complete blood count can also be done as a procedure for patients with giardiasis. White blood cells, normal value ranges from 4,300 to 10,800 cells per cubic millimeter. An increase in eosinophil indicates parasites and allergens invasion that can happen in patients with giardiasis. However, it will not identify the causative agent, which makes this our less priority answer. Platelet normal value ranges from 150,000 to 450,000 cells per cubic millimeter. Red blood cells. For men, it ranges from 4.5 to 5.9 million cells per cubic millimeter. For women, it only ranges from 4.1 to 5.1 million cells per cubic millimeter, as menstrual cycles greatly impact their red blood cell count.
Question number 12.
Since we have already confirmed diagnosis of Aaron through stool examination, the doctor then prescribed a medication to Aaron. What is the drug of choice to eliminate Giardia lamblia for patients with giardiasis? A. Phenylephrine hydrochloride. B. Nicardipine. C. Metronidazole. D. None of these. The correct answer is C. Metronidazole. It is an antibiotic that is used to treat a wide variety of infections. It works by stopping the growth of certain bacteria and parasites. It may also be used with other medication to treat certain stomach or intestinal ulcers caused by a bacteria H. pylori. Inside the cell of the parasite, a pyruvate is then converted to acetyl-CoA, which is a source of energy. This happens through an aid of electron. Now, once metronidazole enters the cell membrane of the parasite, it steals the electron to convert itself as a free radical. Once the conversion is done, it could no longer go outside the cell. As a free radical, it damages the DNA and other components intracellularly, leading to cell death. This dead parasites are then excreted through feces. Rationale for incorrect answers. Phenylephrine hydrochloride is a decongestant that is used to treat stuffy nose and sinus congestion caused by the common colds, hay fever, or other allergies by shrinking blood vessels in the nasal passages chemically related to epinephrine. This is the structure of phenylephrine. Comparing to epinephrine, it has an extra OH group. Phenylephrine mainly functions as alpha-1 agonist. Agonist meaning enhancer. These alpha-1 receptors are found in the eyes, nasal passages and urinary system. While epinephrine is a beta-1 and 2 agonist. Beta-1 and 2 receptors are mainly found in cardiac muscles. That is why in the emergency room, if the patient experienced cardiac arrest, epinephrine is given to contract heart muscles. Once phenylephrine attached to the A1 receptors, it increases the presence of calcium intracellularly. Inside smooth muscle cells, we have this what we called myosin or the thick filament, and an actin which is the thin filament. The presence of calcium unlocks the connector between the two, causing them to bind to each other. The myosin then pushes the actin forward. This process causes the constriction of smooth muscles. Since the pathway is constricted, it causes an increase in the blood pressure. However, the effects of epinephrine are localized, so it has less impact to the systemic blood pressure. So how does this relate to decongestion? Here is your nasal passages and its blood vessel for blood supply. You inhale oxygen and exhale carbon dioxide. Once a foreign body such as viruses or allergens enters to your nose, it triggers histamine causing vasodilation. The purpose of vasodilation is to provide more blood supply and leukocytes in the infected area. Since the blood vessel is then stretched out, this causes an increase in its permeability, allowing mucus to be excreted, pushing the foreign bodies outside the nasal passages. This leads to congestion, not allowing air to pass through freely. Taking phenylephrine then causes the dilated blood vessel to constrict, removing the congestion allowing air to pass through. So you might wonder, this might cause the bacteria and viruses to remain in the area and not removed? You're absolutely correct. That is why most doctors issue an antibiotic together with phenylephrine. Nicardipine, known brand name as Cardipine, mostly comes in vial form. It belongs to the calcium channel blocker family. Is a potent treatment for hypertension by inhibiting the influx of extracellular calcium across the myocardial and vascular smooth muscle cell membranes, causing vasodilation. It acts oppositely to phenylephrine. Inside smooth muscle tissues, presence of calcium binds the actin and myosin, causing a contraction. This causes blood vessel constriction and increases blood pressure. Nicardipine blocks the calcium gateway, disabling entry of calcium ions intracellularly, thus releasing the bind between actin and myosin, leading to dilation of smooth muscle tissues. This creates a spacious flow of the blood in the blood vessel, releasing the pressure.
Question number 13.
Since we have already unlocked the medication of Aaron, it was written as metronidazole 400 mg per tablet BID. How many times do we administer metronidazole to Aaron if the doctor's order is on BID? A. Once a day. B. Twice a day. C. Thrice a day. Or D. Every 4 hours. The correct answer is letter B. Twice a day. BID or bis in die in Latin means 2 times a day. Once a day is abbreviated as OD or omne in die, which means once a day. Thrice a day is abbreviated as TID, or ter in die, which means 3 times a day. Every 4 hours is abbreviated as Q4H, or quack 4 hora in Latin, which means once every 4 hours.
Question number 14.
Nurse Mimi is about to administer metronidazole to Aaron. Prior administering metronidazole to Aaron, what is our important nurse-patient teaching? A. You will feel slight stomach discomfort for the first few minutes upon taking the medication. B. Do not drink any form of beverage aside from water. C. Your urine might temporarily turn red but is normal. Or D. You will temporarily experience metallic taste while taking the medication. The correct answer is letter D. You will temporarily experience metallic taste while taking the medication. Metronidazole causes dry mouth and decreases the absorption of zinc that causes the metallic taste. Rationale for incorrect answers. You will feel slight stomach discomfort for the first few minutes upon taking the medication is incorrect because we can avoid stomach upset if we take metronidazole with meals or snacks. Do not drink any form of beverage aside from water is incorrect because we can let the patient drink other beverages such as juice in controlled amount. However, we are not allowed to let the patient drink alcohol. It's because it will aggravate the alcohol effect, causing decrease in blood pressure, flushing, headache and nausea. Your urine might temporarily turn red but is normal is incorrect because it will not turn your urine into red, instead, it will turn your urine into brown color. How much score did you get? We have a total of 14 items for this session. As agreed, our passing rate is 100%. If you do so, then Aaron would be very happy. He will be discharged soon and can go home, since his friends Mikasa and Armin is waiting for him. If not, then Aaron wouldn't be happy with the result. And you know what will happen next if Aaron will be triggered. So since Aaron is still asleep, retake the exam and make sure you make it to the pass rate. Did you see the mystery egg? If you do, take a screenshot and send it to my Instagram. I will send you the PowerPoint presentation of this video and give you tips on how to surely pass your upcoming exam. You can support the creator so he can create more videos like this by giving donations. Methods to send donations are listed in the description of this video. If you can't, it's okay, you can provide support by subscribing and sharing this video. Thanks for watching.